Well, on to one of our main stories now. KwaZulu-Natal is likely to become the country's next COVID-19 epicenter. The province registered a consistent surge in new daily infections. To talk to us about the readiness to face the worst is KZN's head of the Health Department, Dr. Sandile Shabalala. Dr. Shabalala, thank you very much for your time. Firstly, which areas are problematic for you? You have just overtaken the Western Cape to become the province with the second highest numbers of COVID-19 infections.
Yeah, good morning to you, and good morning also to the ENCA watchers or listeners. I think for us, the whole province is a problem. Mm-hmm. However, if you look at our numbers, you then will realize that the districts, which are mostly commercial districts, starting with eThekwini itself, mm-hmm. and followed by Umgungundlovu, then King Cetshwayo comes in very closely. And we then are also registering Amajuba as the highest district. However, we are worried about the whole province, because if you look at the incidence risk per 100,000 per district, you then find that the numbers are high in all the districts.
Yeah. Talk to us about the behavioral patterns, Dr. Shabalala. The health minister at some point was very worried about the behavior of people who are not taking the necessary measures to protect themselves.
Look, the minister, the premier, and our MEC have always been worried about this behavior, including ourselves, where people still do not wear masks, where you expect them to be wearing masks, either at home, in transit from home to work, and even at work. Even the social distancing issue is another issue that we found. In fact, it is one of the reasons that we supported the banning or the closure of alcohol use, because when we found alcohol was being used, people were behaving even worse than when there were those rights to use alcohol. But also, we think the washing of hands is not as much as we think it should be happening. The other aspect is that we are finding our own healthcare workers getting infected. And from time to time we talk about it, and we are thinking that from time to time our staff, when they are without patients, they are not as cautious as they are when they're with patients. So what we are preaching is that we always have to be cautious against the disease. We do not know where it comes from. Yeah. And also, we must say, if I'm a healthcare worker even in a COVID hospital, it doesn't mean when I go back home I'll be living with COVID. So I can get COVID from somebody at home who does not work in a hospital. So those precautions should be taken even at that level.
Another critical issue, Dr. Shabalala, is the death rate in KwaZulu-Natal. What do you think is the contributing factor to that figure going higher and higher?
Look, what we monitor on a daily basis, among other things, is the very issue of the people who have come to die out of coronavirus. And we're finding that diabetes and hypertension are leading as comorbidities. Yes, the issue of age does have a role to play, but we've seen even younger people dying because they have these diseases. But also, we're starting now to see an increase of people dying from COVID with other comorbidities like the cardiac failure, like the renal diseases. And we're starting to also see an increase in HIV infected people. This is something we did not see initially. Remember, we started having coronavirus in our province in March, on the 5th to be exact. And since then, people that have been dying have not been HIV positive necessarily, but also their age was above 60, above 70 in some instances. Yeah. But now we've started to register people even at the ages of 38, and that is worrying to us. for many other reasons.
There is another crucial element, Dr. Shabalala, I want to explore with you, and that is the number of people who are infected with COVID-19 but are dying in their homes. And that brings into question, therefore, whether or not your stats are indeed a true reflection of what is going on. How many people are you finding that they are dying in the confines of their own homes, and what are the reasons why they are not presenting themselves to healthcare institutions so that they can get help?
Look, the numbers of the people that die, we cannot be able to just speculate, but there is a lot of them that we get a report that so-and-so was sick for a few days or a day and passed on. And so it's difficult to speculate the number as such. However, we're worried about the fact that some of them, when you delve into the history, you find that they may have been in contact with COVID-19 positive people. But also we've been encouraging people to say, we've got more than 16,000 beds available. Let people first check and let people be admitted if they need to. We do have people who have self-isolated. We are encouraging them to be isolated by ourselves where there is difficulty. Yeah. But also what we've started to do is to increase or intensify our contact tracing. This is because we've seen that of the contacts that we trace and test, we find that there is 4.2% of them who become positive. Yeah. Another method that we're using now is to do what is called community screening and testing. In that instance, we merely proactively go and screen people in their communities. We've screened more than 10 million, and we are continuing to do that. Where we think we need to test these people, we then test them. All right. We also must be thankful that the lab is assisting us in terms of covering the backlog, and we think we're doing a better job there.
Dr. Shabalala, very briefly, we are out of time. The investigation by the University of KwaZulu-Natal investigative team around that Northdale death, where a patient died in a parking lot, or what is assumed to be a ward that is just outside the premises of the hospital. Where are investigations there, and might that be a contributing factor to why people are fearful of going and presenting themselves to hospital when they are sick? Because your healthcare workers clearly are not taking good care of their patients.
Because people have been not coming to our institutions even before this incident, I would not say that incident is the reason why people don't want to be admitted in the institutions. Neither would I be able to speculate as to why is it, because some of the institutions have been refurbished. We have employed nurses.
And the line drops us. I think Dr. Shabalala might just be back. Just to finish your thought, Dr. Shabalala, are you still there? No, he's gone. All right, Dr. Sandile Shabalala, he is the head of the KZN Health Department.